Welcome. Thank you all for joining us today. My name is David Jordan. I'm the President and CEO of the United Methodist Health Ministry Fund. I'm also a member of the Governor's Commission on Racial Equity and Justice. Thank you again for joining today's webinar to review the Commission on Racial Equity and Justice's legislative recommendations. Today's webinar is the first of 3 webinars to highlight the Commission's recommendations. Today's webinar will highlight legislative recommendations included in our 3 reports. The February webinar will cover local and county government recommendations, and the final webinar will cover state administrative recommendations, and that will be held in March. We hope you can join us for future conversations. First, I want to thank the commissioners who participated in the commission and who have joined us today. We've had a great group of commissioners that have really worked over the last 18 months to dig into this important topic. We're joined today by the co-chairs, Dr. Tiffany Anderson and Dr. Shannon Portillo, Wyandotte County District Attorney Mark Dupree, Kansas Health Foundation President and CEO Teresa Miller, and Commissioner Catalina Velarde of Kansas City, Kansas. I also want to thank Kate Davis, Governor Kelly's Director of Regulatory Affairs, who supported the Commission's work over the last 18 months. And she has done a phenomenal job in all things related to the Commission. I'd also like to thank the co-sponsors of today's event who have helped us spread the word about the series. We appreciate your efforts in spreading the word about this work. We know that to realize the important changes recommended in this report, it will take a collective effort of everybody on this call, of co-sponsors, and many more folks to realize the important changes recommended. Now on to some housekeeping items before we get started. Today's webinar is being recorded so that it can be accessed for those who could not join us today. We have over 100 participants registered, so we're really excited about the participation. However, we hope we'll be able to provide this important report to many others who aren't able to join us today. We'll be sending an email out with the recording to everyone who joined the call and to additional lists. So please share the link as you receive it. Given the large number of folks on the call, your lines have been muted. However, we hope you use the chat function to engage throughout the webinar. Please introduce yourself in the chat and please ask any questions in the chat. We will be monitoring the chat throughout the webinar and we'll take questions at the conclusion of the webinar. However, don't wait till the end of the webinar to the end of the presentation portion to put your question in the chat. We want to make sure we capture your thoughts in real time and we'll be able to direct that to the appropriate commissioner. And then we'll have some discussion and be able to use the raised hand function to allow folks to ask chat later on. Before turning things over to Dr. Portillo, the agenda for today's webinar is as follows. We cover the introductions, we'll cover the history and background of the commission, the process and timeline, and then the recommendations. And again, we hope to cover questions and have a robust dialogue. I'll turn things over to Dr. Shannon Portillo, the co-chair of the commission. Dr. Portillo.
Thank you so much, Commissioner Jordan. And I really appreciate you pulling us together and organizing this, as well as the United Methodist Health Fund for hosting this event. I'll start by just providing a little bit of history and background on the Commission for Racial Equity and Justice. Our work got started in the summer of 2020. And we know that in the summer of 2020, we saw calls from across the country to push for more racial justice. This was following the murder of George Floyd, and we saw cities, states, and our entire nation really urging us as a community and urging leaders across the country to do more when it came to racial justice. We also want to recognize that our webinar today is taking place on the anniversary of an insurrection at the federal capital, at the nation's capital. This anniversary highlights that there is still significant work that we need to do to live up to our values in our democracy. And so we hope to continue this work and continue to push for more racial justice and more racial equity here in the state of Kansas. But back in 2020, the governor convened a commission of 15 individuals and asked us to study issues of racial equity and racial justice across systems in the state of Kansas. She asked us to focus first on policing and law enforcement, but this is not just a commission focused on policing and law enforcement. We were asked to look across systems in the state of Kansas. Our commission includes individuals with perspectives from criminal justice organizations, education, healthcare, and advocacy organizations. We're looking at broad issues of racial equity in Kansas, and that includes issues of the criminal justice system. But as you'll hear later today, in 2021, we really focused in on social determinants of health. Our 2020 report was the first report submitted, and that really highlighted the first 6 months of our commission's work. That report included over 60 recommendations to state agencies, the legislature, and local government on how to improve racial equity in Kansas around policing and the criminal legal system as a whole. As I mentioned, our 2021 report shifted the study of our initial topic. The commission heard repeatedly throughout our work in 2020 about the ways in which overlapping systems and issues affect communities of colors across the state. We decided to look at this through the lens of social determinants of health, which has become the commission's focus for 2021. Specifically, the commission broke into 3 subcommittees. We were studying recommendations around racial equity focused in 3 main areas. The first was the economic system, which I chaired as a subcommittee. And then Dr. Tiffany Anderson chaired our education subcommittee, and David Jordan chaired our healthcare subcommittee. You'll hear about recommendations specific to legislation in the state from our criminal justice report, as well as all 3 of the subcommittees around the social determinants of health. But I'll turn it over to Dr. Tiffany Anderson to discuss a bit more about the process and timeline of our commission.
Thank you, Dr. Portillo. The commission met every other week. This started in July 2020 through December 2021, hearing from state, national experts, local leaders, community members about topics that were important to Kansans. Meetings included learning sessions, presentations, and discussions. The commission took from these meetings and developed recommendations on improving racial equity for state agencies, the legislature, and local governments. So you'll see all of those recommendations fall in one of those 3 areas. The commission then solicited feedback from the Kansans via social media. People could comment on social media, they could write in, they could call in, they could send letters, or even contact us individually. So the commission's first report includes over 60 recommendations for state agencies, the legislature, and local governments. The recommendations focus on law enforcement training, officer certification and standards, recruitment and retention and promotion, accountability, data collection, public defense, the justice system, school resource officers, tribal jurisdiction, immigration and law enforcement, behavioral health, and law enforcement funding. Now, the commission's 2021 report on the social determinants of health include 90 recommendations focused on the subcommittee subject areas of education, economic systems, and healthcare. As I read these areas, remember at the very end, as you put questions in the chat or put the hand raise sign, we are prepared to answer questions in any of these areas and look forward to the engagement through this process. So those areas included early childhood and child care, maximizing federal funding, tax policy, teacher diversity, post-secondary education, school resource officers, school mascots, maternal and child health, vaccine equity, universal equity policies, housing and homelessness, broadband, wage and lending practices, workforce, access to healthcare, family planning, and behavioral health and ACEs. Those areas also included the juvenile justice system with several judges who were speakers at the very end of our initial session. So in talking about the 2020 recommendations, I'm going to turn this over to Dr. Portillo to go a little bit deeper into what some of those recommendations are.
Thank you, Dr. Anderson. As I mentioned, our 2020 recommendations really focused in on issues of the criminal legal system. And so these are just a few of the over 60 recommendations that were in that first report that we submitted to the governor in December of 2020. The first presented here is that we'd like to prohibit fired police officers from being hired at a different law enforcement agency. And so this would require that an officer fired in one law enforcement agency for egregious offenses cannot be hired in a different law enforcement agency. A law enforcement agency may choose to hire an officer fired from another law enforcement agency for offenses not included in the statute as egregious and deemed as appropriate by the hiring entity. As part of this, we'd also like to mandate a review of records during the hiring process. As we know, criminal justice and law enforcement is highly localized in some ways. And so we want to make sure that CPOST, which is a statewide agency, helps local law enforcement agencies look across jurisdictions to ensure that we're reviewing the records of folks that we're hiring. We also like to require psychological testing for officers be performed by a licensed professional before certification. Currently, CPOST standards require that there is a psychological test before certification, but this requirement isn't focused on an independent or licensed professional. We think it's important to recognize the expertise that's necessary to be a part of this testing process. We'd also like to require that officers have completed KLETC training before they're issued a firearm. This is the Kansas Law Enforcement Training Center. And right now, law enforcement officers can be hired by an organization and receive their firearm before they receive training. We'd like to ensure that everyone has training before they're carrying a firearm in the line of duty. All 4 of these items have been included in SB 247, which was introduced in 2021 in the State Senate Judiciary Committee. We're hoping that this moves forward in the 2022 session. We also would like to see an increase in diversity on the Commission on Peace Officer Standards and Training. This is that CPOST that focuses on certification of officers. Currently, the statute that determines who is on CPOST creates a very narrow range of diversity in terms of race, gender, and geography throughout the state. We think that we should revise this statute to add more qualified professionals outside of law enforcement who are impacted by law enforcement, and include deputy chiefs and undersheriffs, which would allow for a bit more racial and ethnic diversity on that particular panel. We also know that we rely on a pretty significant number of immigrants to propel our economy and to serve in public service within our state. And we'd like to amend the statute that requires citizenship for law enforcement officers. We'd like to align the requirements to serve as a law enforcement officer in the state of Kansas with current US military standards for service. This would mean that people who have been a part of our communities for a significant part of their life as part of DACA, or people with legal permanent resident status, green card holders, would be able to serve as law enforcement officers. This would allow for returning veterans to be able to serve their communities, as well as more diversity in who may serve as part of a law enforcement officer in the state of Kansas.
An area that we heard a lot about both in the 2020 year and in the 2021 year focused on mental health. So we're asking for an expansion of Medicaid to provide mental health and other health care coverage to populations currently not covered. Law enforcement, community members, and leaders all agree that access to behavioral health care is a criminal justice issue. Many law enforcement encounters are the result of substance abuse or mental health issues. Increasing access to early intervention options by expanding Medicaid in Kansas would result in improved policing outcomes. Expanding Medicaid would also reduce state general fund spending on law enforcement and behavioral health. We additionally looked at mobile crisis response models, and this was primarily in 2020. So we're asking for support and finance to the use of mobile crisis response models, including co-responder and virtual co-responder models to assist law enforcement in responding to behavioral health calls and stops. Mental health professionals who ride with and work alongside law enforcement officers can contribute to positive outcomes and promote treatment over incarceration for individuals experiencing mental health crisis. Kansas communities should implement appropriate co-responder programs where possible. Additionally, we are asking a review of racial and bias-based policing policies and the complaint process for law enforcement on a state level. So the legislature really should review the racial and bias-based policing policies that were updated in the statute in 2011 and determine if they are serving the intended purposes. Specifically, the legislator should address the process for filing a complaint of racial or bias-based policing or other complaints related to law enforcement, such as the use of force complaints, to ensure that the process is clear and accessible to all of Kansans. What entity is most appropriate to manage the process of filing those complaints is another area to be looked at. We ask that you look at conducting an independent and thorough investigation and ensuring accountability measures as appropriate. Those are areas we're asking for the legislator to look at and address. Additionally, the availability of data related to such complaints and responsive action taken is another area that we are asking specifically that the legislator address. Another legislative recommendation is to create a law enforcement supervisor training program. KLETC should create a supervisor training program or academy. All law enforcement officers promoted to a supervisory position should be required to attend the college, should be required for attendance to college within 6 months of promotion. The Supervisors Academy should require 40 hours of continued education yearly. This may also take place of the standard ongoing training requirements and should be specific to leadership level. The supervisor training should focus on frontline supervisors and mid-level supervisors and include topics of public administration, law and society, management, leadership, and ethics. Now, the 2021 recommendations are the next several recommendations, and we'll be giving some examples on that. I believe, Commissioner Jordan, you're on mute. Okay.
Okay, thank you, Dr. Anderson. As Dr. Anderson and Dr. Portillo had highlighted earlier, the focus of this year's 2 reports were really on the social determinants of health. And as we start thinking about tackling inequity, we recognize that it's a complex issue and that inequities are built into our systems and policies. So one of the recommendations that spanned across committees of the commission was to encourage government policies and enact legislation to require bias and equity analysis of policy decisions and legislation at all levels. So this would be similar to the process of reviewing the fiscal impact of policies and legislative proposals so that policymakers can understand the equity-based impact of proposed legislation, requesting equity impact statements relative to fiscal impact statements, so that as we're making decisions as a state from a legislative standpoint and from a state administrative standpoint, really it could extend to local government, that in addition to looking at fiscal impact, we're also looking at how policy impacts our population from a racial equity lens. And we think that's critically important. Similar across all work groups, we wanted to pull out the need for more supportive family planning policy, recognizing that a accessible family planning policy is critical to education, economic, and healthcare security. Federal law allows the expansion of Medicaid specific to family planning services up to 171% of the federal poverty level. In this situation, we want to make sure that contraceptive coverage is available to the broadest portion of Kansas women as possible. And with that, I will turn things over, I believe, to Dr. Portillo. No, Dr. Anderson. Excuse me.
The next area is teacher diversity. One of the legislative recommendations is to provide flexibility to student teaching programs for non-traditional students who must work and student teach. We're particularly seeing the importance of this now, but overall, student teachers, that requires that candidates spend full days in schools for several months, and this is without pay. This model was developed many years ago when most college students were traditional. Now, many of today's student teachers include grow your own types of candidates and non-traditional candidates. They attend college part-time because they're adults and they are heads of households. Often they have more than one job, and often they have to care for children themselves. So remedies could include different models of student teaching experiences with more flexibility in scheduling and credit acquisition. The state should create grant programs that districts can access to assist these individuals, and the state and districts should allow student teachers to receive work study support. The juvenile justice system is another recommendation that we're asking that the legislator consider. The legislator should gain a better understanding of problems facing juveniles by setting regular meetings with school counselors. School counselors, they really are the frontline workers with juveniles in Kansas on behavioral health and disciplinary issues. The legislator should set regular or annual or biannual meetings with school counselors in order to really hear about the kinds of issues that juveniles are facing and potential policies for funding improvements. Next two areas really focus on early childhood and post-secondary education. We're asking that we look at improving the Kansas Child Care Daycare Assistance Credit. The Child Daycare Assistance Credit is an existing tax credit. It's administered by the Kansas Department of Revenue, and it's intended to encourage businesses to help their employees find childcare, either by providing childcare services directly or providing assistance in locating services as needed. Kansas can improve this program and expand it utilizing just a few policy changes, such as expanding the type of businesses eligible for the credit, eliminating the reduction of benefits that occurs after the first year when covering the cost of on-site childcare, and expanding the types of eligible qualifications and activities. Post-secondary education is another area that we are recommending. So we're recommending that continued support for scholarships for tuition assistance through programs such as the Kansas Promise Scholarship Act. The state should continue to support and expand on policies such as the Kansas Promise Scholarship Act. It provides scholarships for students attending eligible post-secondary institutions in Kansas for any two-year associate degree program, career or technical education. Additionally, standalone programs that are otherwise identified by Kansas Board of Regents are supported. So we're just asking for continued support and expansion for programs such as that. I'll turn it over to Dr. Portillo to talk about tax policy.
Thank you, Dr. Anderson. So we spent quite a bit of time talking about tax policy as well as other economic issues as part of our economic subcommittee. We did want to just highlight that the governor also has the Governor's Tax Council, which has provided a number of fantastic recommendations around tax policy that affects our state. But one of the most important things when it comes to tax policy in Kansas is that we urge the legislature to eliminate the sales tax on food. Kansas is one of only 7 states in the nation that fully taxes groceries. In Kansas, state sales tax rate of 6.5% on food is the second highest in the country. The legislature should act to completely eliminate the sales tax on food. We also want to ensure that we're maximizing federal funding. And so this means repealing restrictions that prevent families from accessing TANF and SNAP benefits that disproportionately impact families of color. These are federal dollars that we think would help serve Kansas constituents. The policy changes that Kansas implemented in 2015 and 2016 created barriers to accessing TANF and SNAP benefits. Data shows that families of color were heavily impacted by these changes, which directly correlated to an increase in children being placed in foster care. Rolling these harmful policies back would have a number of positive effects in the state: improvements in racial equity, bringing additional federal SNAP and TANF dollars into the state economy, and helping to keep families together and healthy even when facing poverty. We also spent quite a bit of time discussing wages and lending practices. As we all know, we're currently having discussions about inflation and the current rate of inflation, but even as we're seeing inflation rising and the cost of living rising in our state, we haven't seen an increase to the state minimum wage. And so we're pushing for an increase to the state minimum wage and asking that the legislature index it to adjust for inflation. This means that we won't have to continue to have these conversations. We can just ensure that this adjusts as our economy adjusts. The Kansas minimum wage is currently $7.25 per an hour, and it was last changed in 2009. It represents just $14,500 per year for Kansans working 40 hours per week and 50 weeks per year. Minimum wage workers in Kansas are disproportionately people of color, and an increase in the minimum wage would particularly impact current labor shortages in the state around childcare workers, healthcare workers, and other critical sectors. We also would like to see the legislature establish limits on high-cost lending practices in Kansas. In 2021, HB 2189 and SB 218 contain changes to the state's lending law that would cap open-end credit finance charges at 36% and limit fees on such loans and add disclosure requirements to make the cost of loans more transparent. Additionally, legislators should consider model legislation from Colorado, where a 2010 bill limited the maximum interest rates and enabled borrowers to repay loans in reasonable installments. Now I'll turn it back over to Commissioner Jordan to discuss our healthcare recommendations.
Thank you, Dr. Portillo. The Healthcare Committee spent a great deal of time discussing the importance of maternal and child health. And as you'll see throughout the recommendations, there's a lot of connections between the economic work group, the education work group, and the healthcare work group. Central to that is the recognition of ensuring that moms and babies have the healthiest start to life. One of the most critical opportunities that's now available to Kansas and other states is the ability to extend Medicaid coverage for new mothers to 12 months postpartum. This policy change would improve the health of mothers and the health of babies, as they're inextricably linked together. And there's also a disproportional amount of African-American women who are losing their lives because of lack of healthcare coverage 60 days postpartum. In Kansas, on average, each year, 9,000 mothers are dropped from Medicaid 60 days postpartum. By extending postpartum coverage to 12 months, which is a new option the federal government has allowed as a result of the passage of the American Rescue Plan, we would be able to cover those women for 12 months postpartum, ensuring that mothers can have health insurance to get much needed services, ensuring that kids are more likely to get health coverage because their mother is covered, which, all of this would not only improve health, but also help reduce interaction with the child welfare system, because one of the most needed services is behavioral health services during that standpoint. So this is an important policy recommendation to ensure moms and babies have the healthiest start to life, which is critical to long-term health and educational outcomes. Along those lines, we spent a lot of time talking about adverse childhood experiences and interfamily violence. We have recommendations to the legislature to fund programs that improve coordination and partnerships to increase preventive services and guard against the impact of adverse childhood experiences. We know that by investing in evidence-based programs like the Attachment Biobehavioral Catch-up Program, we can see a return on investment for every dollar spent, you get $7 in return for these proven benefits that help buffer the impact of toxic stress in the earliest phase of life for young children. Not only will these preventive policies improve school readiness, reduce interaction with the child welfare system, but they'll improve health, long-term, and economic prospects for mother and child and family. So we urge the legislature to explore evidence-based interventions that can mitigate the impact of toxic stress and adverse childhood experiences, as well as support the partnerships that can help this happen. We know there's been a number of innovative partnerships between police departments like those in Pittsburgh and Wichita that have employed evidence-based interventions, social workers, community care coordinators as a way to not just reduce interaction with law enforcement, but to improve outcomes and health for young families. Another important thing to lift up is the importance of health coverage. We can't say enough about the importance of expanding Medicaid. It's critical that the legislature take action to expand Medicaid. Not only will this help bring back billions of dollars to Kansas to improve health and protect rural hospitals, but people of color in Kansas are disproportionately impacted by the lack of health insurance, and health insurance is linked to the ability to be healthy, school readiness and student success, and employment. So we'd urge the legislature to expand Medicaid to not just help reduce healthcare costs for Kansans, but to improve health, education, and economic opportunity, particularly for Kansans of color who are disproportionately impacted by the failure to expand Medicaid. Another important legislative recommendation that the Healthcare Committee looked into is improving language access and interpretation services in healthcare. this also goes hand in hand with recommendations regarding building a culturally competent workforce. But we know that language gets in the way of access to healthcare for folks, and we have recommended that we make reimbursement for interpretation services more robust and more available as part of this report. One theme throughout the recommendations is the important role that language access has throughout. And we really have made a number of recommendations relative to language access in addition to this recommendation specific to interpretation services within the healthcare field. Behavioral health, as folks know, is an important field that we hear about often in healthcare, and we know that it touches other aspects of life. One way that we've seen Kansans better access behavioral health services as a result of the pandemic is through telehealth. We also have seen through research that Kansans, particularly African-American Kansans, enjoy the ability of accessing healthcare through telehealth where they live and with culturally competent providers. Therefore, our committee has recommended maintaining the policy changes put in place as a result of COVID, looking at maintaining payment in parity with in-person visits, allowing for the use of personal devices so folks can access care in a way that works best for them, and the ability to initiate services at distant sites to make it easier for patients to access services. And for making it easy also for providers to provide services and for care to be provided in a culturally competent way. And as highlighted in this report, these are just several of the recommendations of each committee. There was a very robust report, and there's other legislative recommendations to go with the future recommendations that we'll discuss, touching on local government in February and state administrative policy in March. And I'll turn things back over to Dr. Anderson.
So with both of those, thank you, Commissioner Jordan. With both of those comments, these are just highlights. If you want to see the entire report, both commission reports are available online at the governor's website listed below. Additionally, the recordings of the meetings, the learning sessions that the commission held, the documents used in the development of the recommendations are all also available there. At this time, we're going to move to questions. Some of you have put questions in the chat, and I believe there's a staffer that'll kind of help weed through some of those, but some of you just want to bring some voice to this space, and if you just put up the hand symbol, then we'll know to unmute you so you can ask that as well. Until such time of seeing those, we'll just begin to answer questions based on what we saw coming up in the chat. As we prepare to do that, I know Commissioner Jordan, one of the questions came up from the items that you were just reading in terms of the programs that you were just referencing. I think there was a question regarding what those programs are on the last 2 or 3 chats, and then we'll open this up to the rest of the group. Thank you so much, and we'll do our Q&A starting now.
Thank you, Dr. Anderson. Just looking at the chat, I think the program that Tricia was asking about that I referenced was the Attachment Biobehavioral Catch-Up Program, which is an evidence-based intervention that is really targeted at 6-month-olds to 20 to 48-month-old children. Delivered in a home visiting setting that has shown great success in reducing interaction with the child welfare system, improving school readiness and student success, because it really targets building attachment and nurturance with mother and child, or caregiver and child, which impacts executive function, so the ability of children to regulate their emotions so that they can learn, and also has long-term impacts. It's a very well-documented home visiting program, and we know that there's others like it. I see there's a number of other chats and questions in the chat, so please continue with them, and we'll sort through those. I see that there's a question regarding the recommendation regarding KLETC training before issuing a firearm that Dr. Portillo had mentioned. Would there be flexibility to police and sheriff departments who are backfilling staff shortages who need to stagger attendance at KLTC?
Thank you for that question. And this was one that we did spend quite a bit of time discussing in our 2020 meetings. And one of the concerns is that this is a big issue when we have departments that are hiring a lot of folks, or particularly small departments who sometimes hire and then try to get folks into training. There can be a gap between that hire date and when training can start. And that can be really difficult on departments that don't have a lot of staffing. KLETC has worked to try to make sure that they're starting training more frequently, so departments don't have to wait as long for that gap. But our commission thought it was incredibly important that officers complete training before they have a firearm in the line of duty. This is the kind of basic minimal training that we're asking officers to have before they have that firearm in their place of work.
Thank you, Dr. Portillo. One question that I saw in the chat from Judy Johnston, and I think it's an important discussion regarding the benefit cliff in how do we avoid a benefit cliff if we increase the minimum wage? I don't know if this is something that the Economics Committee had discussed, Dr. Portillo.
Yeah, I think that the benefits cliff is a really important conversation. And this is one that we did talk quite a bit about in the Economic Subcommittee. And I try to answer a bit of this in the chat, but it may be worth having more of a conversation here. In some ways, we need to make sure that benefits are as accessible as possible, which means removing barriers that were put in place in 2015 and 2016. But we also have to recognize that a true living wage, which is what we are hoping full-time working Kansans are earning, wouldn't require those same level of benefits. So really thinking about what are our goals when it comes to a true living wage and accessibility of benefits that families need.
Thank you, Dr. Portillo. I think just sort of agreeing with that recommendation, I think it's critical that we make sure Kansans have access to important work support programs and benefits to help ensure that they're able to access good paying jobs. And it's all of these recommendations really work hand in hand. We had a question about examining the equity impact of policy. So relative to the recommendation of equity in all policies from Tatiana from Kansas Health Institute. This recommendation, and I can take the first stab, and Dr. Anderson and Dr. Portillo may have more to add here. This recommendation really comes from some other states who have looked at Washington State. Their Legislative Services Office does do an equity impact analysis, and it's done on all legislation. Other states have more narrow approaches to this, where they are looking at equity in criminal justice policies, and some other states like Oregon, I believe, are having state agencies to do the equity analysis on administrative policy. As we talked about this policy, I think we agreed that it's important that we understand the impacts of equity and racial equity across both administrative policy and state policy. So I think we were looking to try to have a vehicle where state agencies and the legislature do an analysis across all legislation and departments and how it touches equity. And I think there's some other models to follow. A similar commission in Massachusetts went that one step further with their recommendations in July, and I think that offers some good guidance. So I think there's work that could be done on how this could be implemented. I don't know if Dr. Portillo or Dr. Anderson wants to add any more.
Just as an addition, I think you covered it very well. The only other piece that I would say is that in addition to, the question really speaks to a specific tool for examining that equity impact on policies. In addition to that tool, the other piece is collectively having that ongoing dialogue. We mentioned that in a variety of places, such as having conversations with counselors in some spaces, but in various areas, making it so that anytime there is a policy or a new action, that there's this ongoing dialogue with the rest of Kansans about what's the other impacts and the ripple effect that it has from the equity lens. And as has been mentioned within the report, there are several examples of states and what they're doing and tools that they're currently using.
Thank you, Dr. Anderson. Agreed. I see that Rebecca has her hand raised for a question, and I think we can take a question from Rebecca. If folks have questions, we encourage folks to use the chat, though. If you'd like to raise a hand, we can take you off mute individually. Rebecca?
Thanks for taking my question. I would like more clarity, if you could offer it, on how your recommendations regarding officer histories would differ from what CPOST is already doing. Would it be more government oversight of that process, or what are you, could you specify?
Rebecca, that's a great question. We did meet with CPOST as part of our work in 2020, and I will be honest, we haven't done a lot of follow-up through 2021 and now into 2022. So I know that they were looking at how they could also make their kind of practice more accessible when it comes to people applying across jurisdictions or looking at going into new jurisdictions. But our goal is really to encourage CPOST to share records with local jurisdictions and making that more of a proactive process when people are applying for new jobs in local jurisdictions.
Thank you, Dr. Portillo. Dr. Anderson, did you have anything else on that?
I will just say that currently record review is accessible, but it's not required. And so our goal is to really push this into requiring a record review as part of the hiring process, not just recommending it.
Thank you, Dr. Portillo. An important question from Todd Moore. Outside of the commissioners, who are we engaging in developing policies, priorities, and procedures?
Well, perhaps I'll start and then turn it over to the other commissioners to add to this. So, as we began this process from 2020 to through this year, we have engaged communities from across Kansas and various groups from across Kansas. And really their voice is really what this report represents. Many different people sharing, including law enforcement, sharing things they'd like to see change, adjust, or just be built onto to continue to improve from an equity lens. And so as we roll this out, much like the webinar right today, we have legislators, but the next several webinars, we have other groups that will be engaged in the conversations. And the hope is that this leads to policy conversations, changing priorities, and perhaps implementing some new procedures, both on a local level, a state level, and a legislative level. And so really we anticipate, while the commission came to the table and had the conversations, we're anticipating the collective impact will be individuals engaged in this dialogue across Kansas in an ongoing way, and looking at how some of these policies and practices fit their particular communities. I'll turn it over to Dr. Portilla and Commissioner Jordan to add to that.
I will just thank you, Dr. Anderson. I think that was a great explanation of it. I will say that the co-sponsors that have been a part of this webinar are also a big part of that, as we going to continue to get the word out through other civic organizations and making sure that we're spreading the word of these recommendations, but also hearing from communities about what's worked and how can we improve implementation. Those are going to be ongoing conversations.
Thank you, Dr. Portillo and Dr. Anderson. I agree with everything that's been said. I mean, to get to these recommendations, we engaged in a number of community meetings and then brought in a number of Kansas-based organizations and national experts to help inform these recommendations and ensure that we were centering the recommendations in equitable-based policies and programs and practices. However, we know that the work is really starting with these recommendations in terms of building on them, improving on them, and then building the coalitions needed to build support for entities to advance them. So we're excited by the turnout for this and the co-sponsorship, and we hope to be able to make sure this blueprint or roadmap is used and support the work going forward. There's a lot of great recommendations in here, so we're excited by them, but also excited by the partnerships to move them forward. I'm just trying to pull up the next question from Natasha Russell. Can we speak more about the the issue of a 40-hour full-time cutoff for health insurance used by employers? I'll try to to tackle that question, and if Dr. Portillo or Dr. Anderson want to jump in, we recognize the importance of health insurance to supporting more employment opportunities. So health insurance is really a work support program as much as it is an economic program, which helps reduce economic risk, but most importantly helps people get healthy. We know that there's challenges with full-time insurance, and also there's challenges with the affordability of insurance. We started the recommendations by the need to expand Medicaid. That's certainly just the starting point for making healthcare coverage more affordable. I think there's been some really important progress made under the current federal administration by extending the opportunity to buy health insurance through the marketplace and increasing the subsidies. So I think it's important that we continue to advocate for that. And I think two other important pieces of that here in Kansas are that the Community Care Network of Kansas and Thrive Allen County both have gotten federal grants to enroll folks in health insurance, and they're great resources, as are other groups like the Wyandotte Health Council. So I think we should avail ourselves of those services. And if there's other policies that can make healthcare more available and more affordable, I think those match with the values that we've included in these recommendations. I don't know, and I'm happy to answer any more on health insurance beyond that. Other questions folks have? And just as following up on that question, Terry Kennedy from the Community Care Network of Kansas just posted in the chat the link to the Get Covered Kansas campaign for folks that do need resources for enrolling in health insurance.
And David, I did just see a comment in the chat about the community partners and co-sponsors. So there are a few different pieces of this. Commissioner Jordan put together a slide with all the co-sponsors for this particular webinar, and I think that they're a big help in us getting the word out about our recommendations. But as part of our work, we also engaged in a number of community listening sessions, as well as hearing from stakeholders to develop our recommendations. And you can find videos of a number of those meetings and transcripts and recommendations from those meetings on that website that we posted earlier. A discussion of all of those meetings is also in the full reports. And so you can take a look back and see all of the stakeholders that we engaged. And we'll continue to do that work as we have the February webinar focused on local governments, that's city and county level, and then the March webinar focused on state administrative offices.
Thank you, Dr. Portillo. Other questions folks may have? Excellent. Well, thank you all for joining us. And thank you to the commissioners, Dr. Portillo, Dr. Anderson, for leading this important work, for the governor for recognizing the need to tackle this important issue and to empowering the commission to engage folks. And also to all of you for participating in today's webinar, and to the co-sponsors for co-sponsoring today's event. Again, thank you to the commissioners who joined us and participated. Wyandotte County District Attorney Mark Dupree, Kansas Health Foundation President and CEO Teresa Miller, Attorney Catalina Velarde, AFL-CIO John Nave just joined us. So thanks to all of the commissioners for joining us. And thank you all for being part of this webinar. We're excited about the two future webinars. We'll have on February 10th, we will present the recommendations at the local level, which local recommendations really give us a chance to innovate and practice policy at the local level, which is critical. And then a lot of important state administrative recommendations will be covered on March 10th. All webinars are from noon to 1. You may have signed up for the entire series as part of this. If you have questions or suggestions, please email me at david@thehealthfund.org, and I'll be sure to coordinate with the other commissioners. And thank you again to everybody. We look forward to partnering with you to advance this work. And any last words, Dr. Anderson or Dr. Portillo?
I just want to again say thank you so much for joining us today, and thank you to Commissioner Jordan for organizing this and our future webinars. Thank you to the United Methodist Health Fund for providing this space, and thank you to all of our commissioners who put in a lot of hard work and a lot of hours over the past 18 months to pull these recommendations together. And thank you to the governor for her leadership for seeing the importance of this work. And now the really hard part comes in where we need to really advocate for implementation. So this is where we are asking all of you as community partners to help us with that work so that we can make sure this isn't just a report that gets filed on the internet and never seen again. We want to make sure this is a living document where we can work towards implementation of these recommendations for a more equitable Kansas. Thank you.
And in just addition to that, we just appreciate your time. We know time is an investment, and the time that you've chosen to invest in learning, gaining the resources and in sharing it is truly appreciated. As a superintendent myself, I know the school to prison pipeline is real, and the only way that we can break those and begin to improve things across communities is to work collectively. So your time here shows the collective effort that you are investing, and we so appreciate it. So we look forward to what's ahead in Kansas as we continue to roll this out and build onto the things that are occurring and transform communities in our own spaces. Thank you again, everyone.
Thanks, everyone. Have a great day.